Welcome to this clinical walkthrough on the suspected melanoma case for UKMLA, brought to you by Mediate, your 24/7 practice partner. So today we're going to tackle a real classic, a scenario that's almost a rite of passage in the PLAB 2 exam. Mastering the station is really all about structure and communication. So let's break it down together, step by step.
So, here's our game plan. We're going to walk through the 6 key stages of the consultation, from the moment you read the brief to the final safety netting. Think of this as the structure that'll nail you those marks.
All right, let's dive right in. Section 1, the clinical scenario. This is where it all kicks off, that moment you read that sheet of paper on the door. Let's see what clues we've been given, shall we?
Okay, look at these clues. This is gold. We have an older man, he's a gardener, which means what? Decades of sun exposure, right? And he's got a changing pigmented lesion on his shoulder. I mean, when you see this combo, alarm bells should be screaming in your head. Melanoma needs to be right at the very top of your list before you've even said a word.
Your opening line, it's so crucial. It seems simple, right? But just look at what it's doing. It establishes you're professional, you confirm who you're speaking to, and, most importantly, you use that golden open question, how can I help you today? This lets the patient take the lead, and that is exactly how you want to start.
Okay, Section 2, taking a focused history. Now this is where you really start to shine. It's not just about ticking off a list of boxes, A really well-structured history here will literally walk you straight to the diagnosis and show the examiner exactly how you're thinking.
These 5 points, think of them as your absolute non-negotiables for this station. You just have to ask about changes. You have to explore the risk factors. And you always ask about a personal or family history of skin cancer. A systematic approach here is everything.
This is why we talk about ICE, ideas, concerns, and expectations so much. It's a perfect example. When the patient says, could it be something serious? What are they really asking? They're telling you they're scared of cancer. Your job is to hear that unspoken fear, to acknowledge it, and then to give them the clear action plan that they're asking for.
All right, Section 3, the examination. Now, it's one thing to see the signs, but in this exam, you get the marks for describing them with precise professional language. So you describe what you see, systematically. Looking at this lesion, you'd mention those irregular borders. You'd talk about the variegated color. You see that mix of dark brown and black and even pink? That's a huge red flag. You'd point out the clear asymmetry. And you absolutely must mention any signs of ulceration or bleeding. That's the language of a competent doctor.
And now for what is often, let's be honest, the toughest part of the station, delivering the provisional diagnosis. This is a massive test of your communication skills. You've got to find that delicate balance between being clear and direct while also being incredibly empathetic.
This phrase right here, this is your template. Memorize it. Notice how it's direct. It uses the word cancer. Don't ever shy away from it. But also notice the phrasing, it could be. That's key. It correctly frames it as a suspicion, not a final verdict. And as soon as you say this, your very next words have to be reassuring.
After you've named the condition, you need a simple, jargon-free way to explain it. Something like this is perfect because it's clear, uncontrolled growth of pigment cells, without being overwhelming or terrifying. You should have an explanation just like this one prepared in your mind.
And look, the only way to get comfortable with these really tough conversations is just to do them, over and over again. If you want to try this one out and get some objective feedback, you can practice this exact case right now on mymediate.com.
Okay, Section 5, the management plan. The second you mention a possible diagnosis like cancer, the patient's mind is racing. They have one question: what happens next? And a clear, step-by-step plan is the single best tool you have to manage their anxiety and to show the examiner you're in complete control.
So let's walk through this pathway. First, and you have to say this out loud, I am making an urgent referral under the 2-week wait pathway. Next, you explain what happens at that specialist appointment, an examination and probably a biopsy. Then, you outline the main treatment, which is surgical removal. This logical sequence is incredibly reassuring for a worried patient.
And we're on to our final section, addressing concerns and safety netting. This is how you wrap everything up. It's your last chance to manage the patient's fears, and honestly, providing a solid safety net is absolutely non-negotiable, both for the patient's safety and for your exam score.
Patients will have questions, and you can pretty much guarantee they'll be these ones. When they ask about the sun, you validate their experience. When they ask about speed, you reassure them. But pay close attention to that question about spread. The phrase, "not necessarily," is perfect. It's realistic and honest, but it's not terrifying. It's exactly the right balance.
Your safety netting advice has to be crystal clear. Tell them exactly what changes to look for. And this part is so important. Tell them to call you if they haven't heard from the hospital within 2 weeks. That one instruction creates a crucial failsafe in the system. And finally, some simple advice. Protect the area, and whatever you do, don't try to treat it yourself.
And here's just a great way to finish things off. Offer a patient information leaflet. This shows excellent holistic care. It reinforces everything you've said and empowers the patient with information they can read in their own time. It's a simple gesture, but it's a really powerful one.
So as we finish up, let's leave you with a question to chew on. The structure we've just walked through is your foundation, but true clinical excellence is all about adapting that structure. So think about it. How would you change your approach for a patient who is visibly terrified? And how would you adapt for someone who seems to be in complete denial?
That brings us to the end of this walkthrough. And the only way to build the confidence to handle those different variations is through practice, practice, practice. You can practice this exact case now on mymediate.com.